I'm Dr. James Kennedy, Texas Foot and Ankle Centers. A lot of patients that come into this office need orthotics. Well, what is an orthotic? It's an insert that goes inside their shoe. This goes in to a pair of tennis shoes like these New Balance or my Asics that I'm wearing, but what it is, it's actually a mold of your foot. So this happens to be hers. This is my medical assistant, Clarissa, and if you look at these, this is the exact parabola for her arch right here. So, you know, when she puts these in her shoes, this should make her arch feel a lot better. It has a plastic insert that's very spongy. It makes her feet feel good. It's holding it right up at the arch. But what we're going to do today, we're going to talk about how to mold for a pair of custom orthotics. A lot of people don't understand it. It's very, very simple if it's done correctly. It shouldn't take more than 2 minutes to do the left foot and the right foot, but if it's done correctly, we send it off to a lab, and then they make an insert that's custom molded to your feet that should decrease some of your plantar arch pain. But I see lots of patients with plantar arch pain, plantar fasciitis, lesions on the bottom of their feet, and it does decrease the amount of plantar arch pain that we see in our patients inside the office. This is a mold for custom orthotics. So it comes in a box just like this, and it comes together. Of course, it's got the manufacturer of the orthotics right here. Currently, I'm using a company called Image Orthopedic Lab. They make orthotics, custom orthotics. So far, I've been real satisfied with them. But basically, you just open this box up just like this, and then it's got a left side and it has a right side. So I don't really care which side is which. Obviously, when the molds are made, you can instantly tell whether it's a left or right. But this is one of the most important things of getting it done correctly. So I'm going to start with the left foot, and then after that I'm going to end with the right foot. So here's how I like to mold for a pair of custom orthotics. If you're looking at a leg, okay, if you're looking at this right here, this should be close to 90 degrees. So from here down, it's at 90, just like a 90-degree angle, okay? So the patient themselves, they really don't need to be doing the work. The person that's molding the orthotics is the person that should do the work. So if you're looking at how this works, you want to put your heel in first, okay? Then after that, you want to push down on the first metatarsal, then the fifth metatarsal, then work your way from the first metatarsal all the way back down. And then at the very end, I want her to just barely stand up so it gives the proper parabola of the orthotic. And then I will gently lift her foot out of the orthotic. So the patient should not be doing any of the work. It's the person that's molding the orthotic that should do all the work. So if you're looking at this, let's do this with the first one. So again, she's doing pretty much nothing. See how this is in 90 degrees? So if you're looking at this mold right here, it should have a little bit of the surrounding area that's free. So you shouldn't be getting the foot close to this side or the fifth metatarsal close to this side. So it should be right in the center of the mold. And what I do, I like to push down right on the leg, and I like to grab the ankle, and I steadily push down. So when you steadily push down just like this, okay, you can tell it just hit the bottom. Okay, so next what you want to do is push down on the first metatarsal, and this one's a little bit painful, but I try to go as easy as possible, just like this. Okay, so now we're pushing down on this first metatarsal, and I'm pushing down on the toe right here. Okay, and then now I'm pushing down on the fifth metatarsal. This is the first, second, third, fourth, and fifth metatarsal. Same way down here, go all the way down. Okay, so we'll go right down here. So it'd be the first, second. I'm trying to be as painless as possible, but I think Clarissa would even tell you it is a little bit painful to have this done. So you push down, so first, second, third, fourth, and fifth. Okay, so usually what I do is have her barely stand, so give me your hands, and barely stand up on it. Okay, now you can come down. Okay, and now I will pull her out. She doesn't do any work. And that right there is about as good as an orthotic can look. Okay, so that's a real good mold of an orthotic. Okay, so again, let's do the right one. This one looks about as perfect as you can get. You want to make sure that this is down as far as you can here. The first metatarsal is down as far as you can, and then the fifth metatarsal is as low as possible. Okay, so what we want to do is let's do this one more time. Again, this is in 90 degree, so you're looking from here all the way down. I like to grab here. There's several ways you can do it, but I like to grab here at the leg, and then I also like to grab here at the ankle, and then I do the work. She doesn't do any of the work, and you push down directly here. So I'm pushing in, push down, okay, and then I'm going down with the first metatarsal here, and it's a little bit painful, okay, and then you go down with the fifth, okay, and then you go here, push down here, and then push this one. Push this one, push the fifth one, okay? So then I'm going across again one more time. Okay, and then I will have her grab my hands and just barely go up. Great, and then sit back down. Okay, that's a really good mold of a pair of custom orthotics. The reason why I have them do a tiny bit of weight bearing is because I've been having problems with some orthotic companies making too high of an arch, and lots of times if they make too high of an arch, the orthotics are unwearable. So that's the reason why I just barely have them do a little bit of weight bearing to make sure that the heel, the first metatarsal and the fifth metatarsal and everything in between is set down low enough to where you know that the arch height is low enough to where it can be comfortable, but it's also high enough to where it's gonna give them a little bit of support. So this is how you make a mold for a pair of custom orthotics. So these should turn out really well for her. Okay, that's it.